Hi everyone, I'm Dr. Lin of Rehab and Physical Therapy here in Tustin. We have Stephanie here to help us with nerve flossing. There's several ways to do nerve flossing, so you want to be very careful, and depending on the one that that is chosen by your healthcare professional, these are the ones you want to review. But I like to be more conservative, and some people have you holding these stretches for 30 seconds. You really want to avoid those. So you want to be able to glide the nerves, not really pull. So there's several ways we go about it. So we're going to start here, and I like to show patients, like sometimes you start here, and if you feel a little tug, that can go in your neck or down your arm. So use your opposite hand to monitor your neck. So once you start feeling tension in your neck, guess what? Those nerves are pulling down. And so for Stephanie, no problem, but let's say she did and she felt tension. This is as far as she goes. Now you hold it for 5 seconds only, okay? And then you do it for about 15 times, but 10 to 15 times, but 5 seconds, hold, and then you come back. Now there's some big points I want you to consider when you're doing nerve flossing. One, if it gets tighter after you're doing these progressively, you got to stop. You're probably overstretching the nerves. If you feel that resistance in your neck get tighter, also the same thing. If you feel numbness or tingling, stop. If you feel pain, stop. So tightness, numbness or tingling, or tightness in your neck, those are the things that stop. But for you to progress and go further, then you should feel looser, and then there's less tingling. Or the tingling or numbness or pain even go up a little bit higher into the neck. That's called centralization. That's a good thing. So what we want to do is just here, and so that's kind of how we like to do it. So a progression of this, as you're able to go down here, is just to go out, hold it for 5 seconds, and then back. And you may feel pull anywhere from your wrist, your elbow, forearm, your armpit, your neck, even your collarbone. So these are areas this brachial plexus likes to run. So there we go. And so that's one of the first nerve flosses I like to give. Hold it for 5 seconds, and then back. Hold it for 5 seconds into the tension, and then out of the tension. Pressure on, pressure off. And so there we have it here. Good. And then we're going to follow up with another video for another progression of this exercise. Great. So here's the second phase of the nerve floss. Once again, you want to monitor your neck. If your neck is getting pulled or sucked back into your fingertips or tightened or wiggling too much, those are signs you're going too far. So don't go too far. This is a great exercise, relieves a lot of nerve tension, but you just have to listen to your body and don't overdo it. It's not just your basic stretch. You don't need to stretch more to get more. So it's actually less is more in this exercise. So once you've gone to the first phase and you've gone to a spot, another way is to actually start working on gliding, the ability of the nerves. So we call it flossing because you want to break up the little plaques that go in between these thousands of little tunnels that your nerve goes through. So I like to think of a bowling ball or bowling is to start here, and then once you find that tension, you could stop here. But the ultimate motion you want to get to is to cock your wrist back, open your fingertips, and you should really feel that nerve tension. And you can see that this is about probably where Stephanie belongs, and we don't want to go any further than that. But 5 seconds only. Remember that rule. There's a bunch of research out there saying 30 to 90 seconds, but I don't like that. I think the least provocative is better and has responded really well here in the clinic. So once again, definitely listen to your body. If it's getting tighter, numbness, tingling, pain, and the neck is moving, these are really signs that you're going too far. And if it's doing well, the next ones are less pain, centralization of the pain or numbness or tingling, and then more relaxation. Things should feel lighter if you're doing this correctly. So, and you should feel more synapses, or more nimble is what patients always tell me as well. And there you go. Great. And then so there's one more final one, and we'll cut to that one next. All right, this is the last and final nerve flossing exercise I like to give as a progression. You could, if you're not comfortable with the other ones, don't do this one. So what we want you to do is to cock your wrist, open your fingers, go to the point of tension, and then once you feel that tension, right, it's going to pull into your neck. That's one of your guides. You just back off like an inch. And when you back off an inch, you keep your wrist flexed. And then now we're really trying to promote the gliding through the whole system. A lot of nerves in your organs, in your chest and your pelvis. So we want to be able to add that together. So we're going to do the corkscrew exercise and right there. And once you feel that tension going away from your body, going away from the opposite arm, you're going to feel it tighten and then back. So you want to hold it for about 5 seconds again and then back. Okay? 5 seconds again and back. And two things, if you're really going well, you could go a little bit higher with your arm, it doesn't feel as bad, or you're going lower in the twist. So just go to the point of tension and then back off. Great job. And if you're doing well, those are the signs. If you're not doing well, it gets tighter in your twist, you can't go as far, your arm starts wanting to pull, numbness or tingling, definitely listen to yourself on this exercise. Make sure it's been given to you by your healthcare professional. Great. And then so another one, just to point out again, you want to set it up by going this way, cocking your wrist, bringing your elbow to the point of tension. Once you feel that tension, back off a little bit. Then you can start your corkscrew rotation, lower trunk rotation to start. And that's a great way to start working through this whole system, especially for those of you that have a lot of nerve tension. Great. Thank you very much. I'm Dr. Lin, Rehab and Revive. This is Stephanie. Leave a like and subscribe. And remember, we can and we will get better together.